And that is now live. So again, welcome to our Housing Hangout. This is a monthly event that we do on the first Friday of every month except for January. We typically avoid New Year's Day. Please do say hello, add your name and your affiliation in the chat so we can have a record of that and know who's here. Feel free during the presentations to drop questions in the chat. I'll be making a stack of those questions and asking them in order after all of the presentations have been made. We'll then have plenty of opportunity for back and forth between those of you in the audience and those on the panel. Give just a few more moments. I've got folks still coming in right now. Our last email invitation went out literally 10 minutes ago to remind people to join us today. Feel free, if you'd like, to keep your cameras on. This is a hangout and an opportunity to see people and be with them. Back when this event was live, it was a great opportunity for networking and getting to know people in the community with similar interests. And we still want to preserve some of that, even if we are in this very linear presentation style of Zoom. I'm going to drop in the chat as well an opportunity for everybody. On September 18th, we'll be conducting our quarterly community workday in the Cottage Grove neighborhood around Bingham Park. This is an environmental justice concern in East Greensboro. There was a incinerator and landfill buried underneath the soil of the park in 1953. And material from that landfill has been leaching out into the stream that cuts through. We go out and do some environmental awareness work, as well as cleaning up the stream, removing debris, removing trash and other things to improve the health of the ecology there. It's a great opportunity to get some exercise, to be outdoors with other people in a safe and socially distant manner, and to contribute to this environmental justice work. So again, I dropped the link to that event in our chat. It's go.uncg.edu/Buffalo Cleanup. Also, since we have just a moment here, I'm going to have Haiyang Su, who will be our facilitator for next month's Housing Hangout, just give the title and one or two points about next month's Housing Hangout on education and housing.
Hello, everyone. Hello, everyone. In our next Housing Hangout event on September 3rd, we will have speakers talk about housing and schooling. We'll basically cover what aspects of housing conditions have been widely recognized to impact education outcome, and to what extent can housing policies assist schooling, and also the situation of homeless students. We will send out invite for you to register for the September event, and also you're all welcome to join the event. Thank you.
Thanks, Haiyang. So with that, I'm going to turn things over to Dr. Ken Gruber, who is a senior research scientist here at UNCG. He's been conducting evaluation research on asthma and housing for 7-8 years now, at least, in a series of projects that have culminated in Invest Health Initiative, Build Initiative, in collaboration with our community partners, and several papers that have come out of his research. Ken, take it away.
Thank you, Stephen, and welcome everyone. I hope that today we'll have a really good discussion about asthma and well, actually childhood asthma primarily, and housing conditions. I'm gonna lead off with the presentations, but my co-presenters today, Nisha Graves is an environmental health outreach manager in the UNC Center for Environmental Health and susceptibility, so she'll be following me. Following her will be Gina Uresti, who's the Healthy Homes Manager at Greensboro Housing Coalition. And finally, Jamila Pender, who's the Assistant Director for Healthy Communities for Cone Health Foundation, Cone Health System. So we're going to be, in some sense, tag teaming with the things that we talked about. There will be some overlap, but this issue is just important enough that I think that you'll see there are reasons to overlap when you're talking about this from different perspectives. And in fact, I think one of the beautiful ideas about a housing hangout is that it does give us a chance to hear sometimes the same topic just from different perspectives. And you can take the same information and see it differently when you have a different perspective. So hopefully that today that you all will learn some stuff about housing and childhood asthma from our perspectives, but then we'll learn from you from your perspectives. So I'm gonna go ahead and start now. I'm gonna go ahead and I have a slideshow to go over with you. Okay, one of the things I want to start off with before I start talking about the slide is that we're going to make the presentations available, and I'm making this PowerPoint available, but also I have a companion document that's kind of a really brief research summary document that will also be available, and it covers some of what's in this PowerPoint, but then there's some other information in there that I thought might be of interest to you. So there'll be two documents from me that you will be able to read at your leisure. So what is asthma and how's it connected to the housing environment? Well, we all know that asthma is a serious lung disease. And I'm not going to read all my slides. I'm going to talk about my slides. I'm not going to read my slides. But we know that the symptoms of asthma include wheezing, shortness of breath, and coughing that typically require medication to get under control. And when as a child, it becomes even more concerning because you don't, as a parent, you don't know what's going on necessarily. The child doesn't necessarily know what's going on. And it's a very frightening experience for those who have undergone it. So we know asthma really needs more from all kinds of perspectives, more study, but more ways of preventing it from happening in the first place. Now, what we don't know is we don't know enough about why folks develop asthma. We have some pretty good ideas about what's contributing to the incidence of asthma, but not why some people develop and why others don't. But we do know that people who have asthma are sensitive to very small particles that they breathe in. And the second sentence here in the second line is most of the time these particles come from mold, dust mites, wood smoke, cigarette smoke, cooking odors, aerosol sprays, air fresheners, scented candles, paint fumes, and pet dander and pollen. And that's just the beginning list. I mean, there are other triggers, if you will, of asthma that come from other sources as well. And with that thinking, that I think when we're talking about housing, we really want to figure out how do we get to these triggers? How do we remove these triggers? Now, some of you may have seen this before, and if you haven't, this is kind of a neat little picture of.
Ken, could you share that screen? We're not seeing it.
Oh, you're not? Oh, I'm sorry. Okay, hold on. I thought everything was working fine. Okay, so let me end this. Let me stop my sharing then. Hold on. Great. Where's my slideshow here? Come back to it. Come back to share screen. So, can you see my screen now?
Yes.
Okay.
Good, thanks.
Wow. Okay. Sorry about that. Let me back up a little bit. Okay. Well, let's
And click on from beginning. Over on the right there. Yeah.
Yeah. Okay. So the first slide, I won't go back over, but the second, because you all have it. The second slide. Okay. This is a kind of a nice diagram of many of the potential triggers that might be in a home. Now, I'm not going to talk about all these today. My colleagues may talk about some of these. I am going to talk about a subset of these, but I think it's useful to think about this in a sense of look at all the possibilities that might be an issue for a child and or an adult any or all of these, well, probably not all of them, but many of these might be a trigger to an asthma event. So there's a lot of things to do in a home in order to make it safe for somebody who has asthma. And it's a tall order. And as we talk about this, we'll find out that there's just a lot that has been done, a lot that we know, but there's an awful lot we don't know. Okay, so how many children, I'm going to focus on children, how many children do have asthma? Well, there's a variety of estimates, but we think there's probably at least 10% across the United States. And in some communities, it's up to about 25%. So it's a very serious problem. And as I mentioned at the outset, it can be a very life-threatening problem. So it's something that we must deal with. And what we're going to focus on primarily today are the indoor environmental exposures. And there essentially are two categories. There's allergens and pollutants. Well, actually, there's three. There's allergens, irritants, and pollutants. Those are the particles or substances that contribute to asthma prevalence. And when I mentioned to you at the outset about what we don't know about why we develop asthma, what we do know is that when children develop asthma, it's because that they develop a sensitization to some particle and or some substance, and usually those substances are proteins that just irritate the airway, and that results in their having an allergic reaction, and that is essentially is what is contributing to their asthma response to it. And obviously, children who have severe asthma are oftentimes they have multiple allergens that they're responding to.
Of Ayana Wilson. This is Jacqueline.
So I'll overlook that. Okay, and we also know that while allergen exposures is the most significant contributor to asthma, we also know that there are other reasons, other irritants and pollutants, but I just mentioned that cause asthma. So my point here is that it's not just one thing. It's many different things, and it's a real challenge to figure out which of these things, I'm going to call them things right now, which of these things might be what causing someone to have an asthma attack. And even if we address that one thing, there may be others that are also problematic as well. So it really is a real challenge. Okay, so let's talk about the indoor environment real quickly. In any home, there's the opportunity, unfortunately, to be exposed to a lot of conditions that can influence the development, prevalence, and incidence of asthma. And the exposures include biologics, and you can read this, but also pollutants, matter from gas stoves and cigarette smoke, and even outdoor sources. And many of the known allergens are the ones that you probably are already familiar with. They're dust mites, domestic pets, mold, cockroaches, mouse, environmental smoke, and air pollution. These are the common ones, and these are the ones that we most have. These are the ones we know the most about, and these are the ones that we try to do the most to remediate or intervene on. But we also know that there's all of these, and then they are in combination, and then most of these have their own variations. So it's a real challenge. Just I'll get to in just a minute, but just mold. There are lots of types of mold that folks can get sensitized to that lead to an allergic reaction. Well, it's fine to talk about removing mold, but if you have certain kinds of mold, it may be more problematic than you have other kinds of mold, and some molds might be more resistant to being removed than others, and so it goes on and on. So it's really a war against these triggers, and I think we're doing a pretty good job from the time that I started looking at this. But it's a war that's definitely worth fighting, but it's one that we still need a lot more on our side to kind of overcome this, if it's even possible. And in terms of cleaning up things, the most effective environmental control measures are tailored, multifaceted interventions, which include education, thorough cleaning, using high efficiency particulate HEPA filters, integrated pest management, and maintenance of these practices. So the solution is this, okay? But the problem with this solution is, as I was just saying a moment ago, is if you just think about it in terms of multifaceted interventions addressing a multi-set of triggers, wow, that becomes pretty daunting in terms of how do you do this? Okay, so getting back to what are the main two types of asthma triggers are the allergenic one, meaning someone has a sensitivity to it or is allergic to them, or an irritant. And so those, as I was saying earlier, those are the ones these are the particles that are giving us problems. And so it does matter whether or not you're trying to remediate indoor environment. It doesn't matter which of these you're trying to go after, because they do require different solutions. But that's the point. It needs to be a multi-dimensional, if you will, or multi attack on the different types of sources that might be causing asthma. And I'm going to say right up front, most of the time when there's someone who has asthma, we don't know all the triggers. We don't know. We may know some of the triggers. Yes, you can get a test, and you can be tested to what you are allergic to, and that can really zero it down pretty well. But the point of it is that even if you know what you're allergic to and what you're responding to, you don't necessarily know where it is in your environment, or maybe you can't even control it in the environment. So you might know what's causing you to react, but you don't necessarily know how to remediate it or remove it from the environment. And so again, I think in our discussion today, we'll talk some about that and just talk about what we're trying to do in order to improve things. So I'm going to go through very quickly just some sources of asthma triggers. There are dust mites, and dust mites actually are little arachnids, which means that they are little spiders that live in dust. And probably all of us have exposure to dust mites. And the dust mites are one of the most common sources of folks, of particularly children, having allergic reactions. And it makes a lot of sense in terms of when I mentioned a few minutes ago about being sensitized to something. Children spend a lot of time on beds playing with stuffed toys and all, and they are being exposed to these particles. And at some point, the particles and their lung system don't get along very well anymore. So they have this reaction to it. And so that's probably one of the reasons why dust mites are a leading cause, because there's so much early exposure, and the immune system just doesn't do a good enough job of preventing it from being an irritant or preventing the airways from reacting to it. So that's probably it. In terms of cockroaches, we all know about cockroaches. There's the German one and there's the American one. Both of them are sources of allergic reactions. There's mold. I mentioned mold. There's plenty of studies that have looked at mold and looked at how you can remove it. Yeah, obviously you want to make the place drier and that type of thing. Some studies show though that not only is it mold, but just dampness. Some people are very sensitive to cold and dampness. So we sometimes think about mold and mildew. They're not necessarily the same, but even wetness, dampness can cause a reaction. So sometimes it's not the mold; it just may be the dampness and the cold, which is down here. Plus, damp and wet conditions contribute to the growth of some of these other triggers. So we have a problem when we're trying to say, okay, let's just get rid of cockroaches. Well, we get rid of cockroaches, but we also got to think about why are they there, and how can we kind of work our way back to why are they living in the environment, and how can we remove them from being in that environment? And it may be that there's multiple reasons why that they're there, and one of the sources might be dampness, and because cockroaches obviously need moisture. We got rodents mice and rats. And one of the things that I've found in looking at the literature and I found this quite interesting is that skin, hair, and droppings of mice and rats produce the allergen particles that children develop an allergy to. And it's very common for children to develop an allergic reaction to mice, but it's not as common for them to have an allergic reaction to rats. And if you think about it, it's mice are almost always indoors. And again, this is where children can be more exposed to what mice produce than what rats produce. So it's not that rats don't produce allergenic particles. It's just that children are less likely to encounter rats, and so rats are probably about relative to mice. They're probably less likely. They are 1/3 likely to be a source for an asthma attack, partly because of just exposure to them. Okay, wood stoves and fireplaces. These are they produce nitrous oxide, which is a real problem because it serves as an irritant. There are ways to take care of this. Number one, if you don't need a wood stove, if you don't need a fireplace, and you have an asthmatic child, don't operate it. There's also the thing about they have come along. Engineering and all, and technology has come along with having vent-free stoves and all. So there are ways of improving this, but wood stoves and fireplaces are just adding more possibilities of contributing to allergic reactions of things that this is something that is it's something that can be fixed. I guess is what I'm trying to say. Heating and cooking fuels. Again, nitrogen oxide, you can read what's there. Real problem. Some folks that they like to cook in certain ways and that kind of thing, and those fuels and the fumes from that can be very critical irritants to a child. And so again, if you can figure out ways to not cook with certain fuels, particularly fuels with that produce nitrogen oxide, and those that are petroleum based, you'll be better off if you can avoid doing that. And one of our biggest problems is secondhand tobacco smoke. Tobacco smoke is a real problem for so many people. And one of the things is that of all the efforts to try to remove secondhand tobacco smoke, and it's true for the wood stove, fireplace, and cooking fuels, trying to use ways to filter the air, it works to some extent, but it just doesn't work well enough. Tobacco smoke lingers for such a long time, and even if you get the smoke out, if you will, the substances that remain, the nicotine, which becomes codeine after it's been processed in the body, it lingers for such a long time that no matter how much cleaning you do, you're probably not going to be removing it well enough. And so when we see interventions trying to figure out how can we use filters to kind of clean the air and make things better for a child who has asthma, it does improve. It does reduce asthma symptoms. It does reduce unnecessary visits to maybe the ED and all, but it's still there. It's still a problem, and children still react to it because it's there. And plus, it tends to, what's the right word here? It tends to add it tends to compound the problems with some of the other irritants and allergens, so that it by itself is not necessarily the problem, but in combination, it really does represent a real problem. So even when people say, well, I'll go outside and smoke, that's all well and good, but when they're coming back, they have this, they have some of the tobacco smoke and others on their skin or on their clothing. They're bringing it right back inside, and that can be problematic. So the recommendation is do not smoke in the house at all, particularly if you have a child with asthma. But as we all know, that's a difficult thing to do. Okay, real quickly here, pets. Well, a couple things that I found interesting for pets was that cats are worse than dogs. Cat dander and it's both their dander, their skin, and their hair, but cats. There's one study that found that it was up to about 24 after they removed cats. It took about 24 weeks for the essence of those cats to be completely gone, and that says a lot. So their dander and all just gets on everything, and it's extremely difficult to clean. Another study said, well, you could bathe a cat, but that lasts about a week. And I don't know how many of you folks have ever tried to bathe to wash a cat, but that's a difficult task. Looking at dogs, sort of similar. Dogs are a little less problematic, but you'd have to wash a dog twice a week in order to remove most of its allergenic problems. Also, another study looked at the idea of dogs being, I'm going to look up the term here real quick. I'm forgetting. Oh, hypoallergenic. Sorry about that. Their idea is that, okay, can you get a hypoallergenic dog? Well, there kind of isn't that kind of thing. That dogs are going to produce these proteins anyway, and so studies have looked at those dogs, looked at the hyperallergenic dog versus the non in several breeds, and they really haven't found much difference in terms of if you have a child that's allergic to them, then you're going to probably have a problem whether they're a hypoallergenic dog or not. Okay, cooking odors, paints and solvents and perfumes, these are less problematic, but they are problematic to folks. And so we all have to think about, if you're trying to do an intervention, you need to be thinking about, what do I need to collect based on what's going on in the home, and what kinds of things might I need to do to either remove these or to lessen them. As I said, pollen, flowers, cards, off foods. Now, this is kind of getting to the outside, but this was included in the American Lung Association picture. But also, these come indoors too. We bring pollen inside. We bring pollen, and flowers produce pollen. We bring them in. We bring flowers inside. And even cards fumes, when we open a door, we're bringing it in. So even though some of these are on the outside, they come inside. Okay, so real quickly and real briefly, in looking at kind of the focus, here's just a listing of some of the various foci, if you will, of how folks, or what folks have looked at in terms of trying to improve conditions. And I'm not going to read the list, but it basically is removal of the sources of the triggers, cleaning the triggers, cleaning, putting up barriers like air infiltration. All these kinds of ways have been looked at in terms of trying to remove problematic triggers. And I can tell you that the literature is positive in a sense of it does work, but it only works to an extent. And I'm going to talk about some of the limitations of it, about why it's not working as well. But it is encouraging that we're able to do some studies and see that, yeah, if we embed sheets and upholstery with plastic wrap or something else, that we can reduce dust mite problems. We obviously can use integrated pest management and reduce cockroaches and mice and other rodents. We can be successful with that. But again, these are strategies that are all good. But I think what we need to think about is how can we do this in a way that's very systematic and doing it the most effective way. Some solutions are not necessarily the best solutions. Like, for example, you can use roach kill to kill roaches, right? But the only thing is the chemicals in roach kill might cause an asthma attack, because you're kind of getting rid of one problem, but you're adding in another problem. So we have to think about all these as we go forward. Now, I'm going to go real quickly. I want to give a couple, as I mentioned before, I have kind of a handout that will be made available, but I'm just going to kind of summarize a little bit of the literature for you. And I do have this article it is linked, so you'll be able to get a copy of this article if you want to look at the Asthma Partnership Demonstration Project article that I and some others a few years back did, where we looked at folks that actually we looked at children who were referred from Cone in terms of having been in the ED twice or been hospitalized for asthma, went in there and made some changes to their housing in most cases, in some cases just education. And we found some really impressive results by just how much an intervention, a very low cost intervention, worked in terms of improving the housing environment and reducing the likelihood of these kids going back to the ED or the hospital. So I want to, even though I'm sort of saying we don't know enough, I do want to say that there's a lot of progress, and we are seeing some pretty good things that are happening. A couple of real quick things to kind of end on. I thought it was interesting when I was looking at the literature, that the range of studies has gotten bigger and bigger and bigger. One that makes sense is housing code violations. And you find out that those, of no surprise, housing where there's housing code violations tend to be associated with more kids with asthma and more asthma problems. So no surprise there. Another study looked at kids who were living in homes with federal rental assistance versus not. And the federal rental assistance kids were doing better than kids who compared with families who were not getting federal rental assistance. And that makes sense to me in a sense of if they have a steady flow of income to help pay for their housing, they can probably keep it up a little better, keep it cleaner, and perhaps the housing itself is in order for the family to qualify, probably has to keep itself has to be kept up too. So these are all this represents kind of a multi-intervention way of looking at things without actually talking about the home itself, but just looking at just the relationship of the rental assistance piece of it to probably what's going on. Now they didn't report on changes in the housing environment and that type of thing, but I would suspect if we were to look at the differences in the house in the units themselves, I bet you we'd find some real patterns of differences showing that those who are getting rental assistance are probably keeping their homes a bit cleaner and probably just have fewer environmental triggers in their home. Some home visits for pediatric asthma. That there's been a lot of studies on that, but I wanted to share these two. And this last one here, the social determinants of health. You all have probably heard a lot about social determinants of health, and this is an interesting study. The point of it is that I think as time goes on, we're looking at all kinds of ways of figuring out what can we do to change not just the housing environment, but the family environment, so that we can make improvements in the home. Because while I think the main focus of today is to talk about the unit itself and what we can do, but there's a lot of factors we need to take into account when we're thinking about what is contributing to the fact that there are asthma triggers here, some which are well beyond the control of the resident, but in other cases it's things that if the resident had more resources, then maybe some of those triggers could be either eliminated or at least reduced. Okay, real quickly, why do interventions may not appear to work? Well, the volume or the intensity of the intervention may fail to sufficiently reduce an exposure. So if let's say it's mold and we go in and we do and we remove all the mold we see, well, what we see may not be all the mold, right? And so that may be an insufficient intervention. All right. If an individual is not sensitized or exposed to the target allergen of the intervention, there will not be a significant improvement. So if we think that a child has an allergic reaction to something and the child doesn't have that, we can clean the home all day long. We can do all kinds of things, but we're not focusing on the right trigger or right set of triggers. Reducing exposure in one location, but not all, will likely be ineffective. A lot of interventions oftentimes focus on the child's bedroom, and sometimes even more specifically, either the bed or if there's a rug or a stuffed toy, and all those are good, but the child does not necessarily live only in the bedroom, and so there may be other places in the home where the child comes into and gets exposed to what is a trigger or multiple triggers, and so that's why that intervention is not necessarily the most effective. And then the intervention may not be adequate to reduce the level of allergen or airway irritant. So I mentioned before, filters work well up to a point, but they're oftentimes insufficient to really make a difference. And so we see studies that show that, well, it improved the air quality, or it improved the presence of the particular allergen, but they still had an asthma problem because they didn't get the level of allergen out of the home. And then probably the biggest one is that all sorts of irritants may not be addressed with one intervention approach. So cleaning something is great, but fixing something, removing it entirely is probably the better approach. But as you know, as we try to fix things, as we try to rebuild things, that becomes much more expensive. So anyway, so these are some of the reasons why, when if you look at the literature and you wonder, well, gosh, it wasn't all that effective, these are probably a good set of reasons why they were not effective. But as I said at the outset, there's so much we know, but there's just so much we don't know. Okay, and here's my contact information. This will be on the handout, and you'll also be able to get this information off our website. Thank you.
Hey everyone, I think I'm next. You want me to go ahead and jump in?
Jump in.
All right. It says the host. Oh, I can't share my screen.
Hold on.
Okay, now I can.
Okay.
Great. Gotcha. All right, I think everybody can see my slides. I'll jump right in. My name is Nisha Graves, and Ken already introduced me and certainly did a great job introducing the topic for today around environmental asthma triggers and asthma itself. And my job is to talk a little bit about environmental practices that help to make homes safer, especially as it applies to children and asthma. And so I have quite a few slides. I have a few slides, and I'm going to go through a few of them quickly. And that's the great thing about you all getting them later, so you can refer to them later. But certainly feel free to ask questions. Maybe when we're done, I know there's a Q&A opportunity, or to put things in the chat box. So I work at the UNC Institute for the Environment. That's my home office. But the work that I do around asthma and healthy homes is funded by the National Institute of Environmental Health Sciences in the School of Public Health at UNC. So that's why you see the UNC Center for Environmental Health and Susceptibility. In a nutshell, that pot of money pays for this presentation. So that's how I list that organization. And I will keep going. So just real briefly, this is kind of a visual that we use a lot of times. You may have seen me if you've ever participated in presentations with me before. We've had this redesigned a little bit from the National Heart, Lung, and Biology Institute. And you see here that sort of the difference between a healthy airway and an unhealthy airway at the bottom of the screen, particularly for people who may be suffering from asthma attacks, the buildup of mucus, inflamed walls of the airways, muscles tightening around the airways. So that's what happens when a person is exposed to the types of environmental exposures that Ken talked about earlier, and some that I will highlight and that others today will highlight. But this gives you a good visual of what happens to the lungs airways to keep us, and it's important to know, it keeps you from breathing air out or in. So even putting air out is difficult. So we address 5 different healthy homes themes or issues in our training and materials that we developed. But I wanted to showcase how 4 of the 5 can involve environmental asthma triggers and involve the burden of asthma around the home setting. And so it's pretty daunting when you see just how much can impact a child's asthma in homes. Another way to look at this, and you see the maintenance and monitoring down at the bottom, there's overlap when you look at the 5 things we always tell people to monitor and to maintain on an ongoing basis in their homes. So some of what I talk about, some of what Gina and Ken have talked, what Gina will talk about, what Ken did talk about, you'll hear some overlap, but I just want to point out that we talk about this overlap even in our own trainings. We look at how this overlap occurs. And so I just wanted to point out that, yes, we have these issues, but yes, some of it involves kind of paying attention all year long to what's going on in your home. I will also say, when Ken asked me to present about practices for addressing asthma, one key piece of research that we share in our asthma workshops and often in our healthy homes workshops too, especially with public health professionals and with any community members, is the research shows that asthma outcomes, as they relate to your environment, asthma outcomes are the best when you try to address the different triggers simultaneously, all at the same time. So that's why you see this slide here kind of pointing to, okay, there may be a number of different triggers that impact a child's asthma. You've got to address all of them at the same time, diligently. And so that's why we showed this slide and we highlighted in our work. Now I'm going to jump into some examples. Ken asked me to talk a bit about conditions around housing that cause certain issues and what should be done to help prevent asthma and other respiratory problems when it comes to asthma and healthy homes issues. And I thought I would start with carbon monoxide because it has an interesting historical slant to it too, and because frankly, we want to acknowledge the fact that there are some communities in our state and in our country when housing is substandard, they suffer the most. And so I wanted to point that out, at least in this example. I'm sure there are other examples that everybody on this call can think of, but this is a good one because it relates to a specific environmental health concern that I'll talk about. So I don't know how many are aware, I'm assuming most are, that about 18 months ago, McDougall Terrace, which is operated by the Durham Housing Authority, had a concern about high levels of carbon monoxide on the property for over 300 of the units that exist in that housing development. It's important to know that it was built in 1953, and part of the issue with the carbon monoxide poisoning was age of the gas appliances and heating systems in that housing complex. So that's why when Ken asked about, talk about some of the background information, this is important to know about older housing and the what is inside the older housing. So there were high levels of carbon monoxide. Over 300 families literally had to be moved into hotels, and many for many months, well into 2020. And then we partnered, Carolina partnered, my program partnered with NC State, Legal Aid, and a couple of other community programs to help share information with families about environmental health hazards like carbon monoxide. What are the health effects? how do you protect yourself from carbon monoxide, et cetera. So I'll show you a little bit of what we talked about with families, literally holding little community workshops in the lobbies of the hotels. So we let people know it's the fuel burning appliances, kerosene heaters, gas stoves, et cetera, that are the sources of carbon monoxide. It travels through the body very quickly when it's breathed in from the air. Treatment for it is oxygen, clean air. That's why they tell people run out of your home as soon as you know that you have high levels of carbon monoxide in your home. Open the windows, the doors. The symptoms get worse depending upon the amount of time you're exposed and how much of the carbon monoxide you're exposed to. And I want to point out, when it comes to asthma, another trigger from fuel burning appliances is nitrogen dioxide. And research shows, there's a great study in Baltimore showing kids, school-age kids, who were having severe trouble with speech and concentration in school due to their exposure to nitrogen dioxide, and they all happen to be pediatric asthma patients. So I think it's interesting to kind of know the background information around that. So here's in a nutshell what we advised people with regard to what you do and what you don't do to protect yourself from carbon monoxide. You need to have good ventilation, proper ventilation. We'll talk about that a little bit later also. So there needs to be clean air coming into the home. You need to have working carbon monoxide alarms. That was a big issue with a lot of residents from what we were hearing from them in the workshops. Make sure the gas appliances and stoves vent to the outside and not to the attic, not to the basement, but to the outside. Don't use portable gas stoves indoors. Don't run your car inside a closed garage because that's just building up the carbon monoxide in a closed structure. And we found that families, and this gets back to low income and families who are really suffering, not using the oven as a source of heat, because that is another issue. And then especially with unvented gas stoves. And then not smoking in the home, because smoking creates carbon monoxide also. So I went through that quickly, but carbon monoxide is one issue. Then we're dealing with moisture and mold. And I like showing this little graphic. It's a 3-part graphic. This is the makeup of a home, but I want to show why and how we deal with moisture in a home. So there are everyday things in life that occur. We shower, we boil water, we cook. There's water vapor in the soil next to our homes. So this is just everyday life happening. But then there are things that are wrong with the home. So window condensation, meaning something's wrong with the ventilation. Clogged gutters, meaning if you don't clean up the gutters, if you have the water can build up after heavy rains when you have clogged gutters, and it can seep into the material of your home. Leaking pipes, leaking roof. So a number of different broken issues that need to be repaired, as opposed to things that happen in everyday life. So I wanted to kind of point that out, because Ken was saying, let's talk about, what can be done in the property to make it safer. And mold and moisture, particularly for kids who are sensitive to it, it can be an allergy. It can be an allergen that they're dealing with, and it can be an asthma trigger. In addition to those issues in homes, I thought it's important to point out the fact that we have a large population in the state of North Carolina, maybe not so big in Guilford County or Greensboro, but certainly in the rest of the state, in other pockets of the state. And it's important to think about how mobile homes are really susceptible to excessive moisture and mold, pest damage that can get into the home as a result of excessive water in the home or in the property. So I thought this was the best way to remind people that we should be mindful of mobile homes as another potential problem for kids who have asthma and a home that can have excessive moisture damage. Here are just some images of where moisture can build up in a home. They're pretty self-explanatory. The top right corner is like a leaky roof that's seeping into the drywall in a home. The window condensation. And to be honest with you, for those of us who are professionals, I don't often use the word window condensation. Sometimes it helps to tell people, do you ever see that water build up inside on the windows? So just be, think about how we also share information with people too. At the bottom left, it looks like water stains from a from a washer dryer setup. And in the bottom right corner, buildup of mold where it looks like something was leaning up against it and moisture built up. Ideally, we want indoor humidity to be between 30 and 50%. And I'll show you a device that you can purchase. And asked about technology. And so it's only $10 or $15, but it's technology. And most of us can get it if you're curious about the humidity in your home. And here it is in the very middle of this slide. And this whole slide kind of shows what we tell people to do to prevent moisture buildup in their home. So fix the leaky pipe, fix the leaky roof, clean those gutters. Make sure you're right here in the bottom right corner, make sure your exhaust fans in the kitchen and the bathroom work. And if you don't know how well they work, you can put a sheet of toilet paper up against it, turn on the exhaust fan and see if it sucks it up. Your goal is to make sure that exhaust fan is ventilating properly. In the top right corner is a dehumidifier. Not humidifier, but dehumidifier that sucks the water out of the air. A lot of people use these in basements and other rooms in the homes that might tend to have moisture buildup. But I just want to emphasize we're talking about a dehumidifier, the sucking water out of the air in your room. And in the middle image, this is just a humidity monitor. $10 or $15 on Amazon or the home improvement stores. And there are different brands that you can get. We've purchased 2 or 3 different brands and they all seem to be pretty reliable, but it gives you your temperature and it gives you your humidity range. And you see here, the humidity is much too high at 74%. And then the other strategy dealing with moisture is to remove the source of moisture. So the easy thing that everybody thinks about is on the right side, cleaning up the mold. But the more difficult thing that people have to deal with is actually getting the material, getting the water damaged material out of your property. So it might be drywall, it might be carpet. There could be, the parts of the structure that are so damaged that have to be removed. Eastern North Carolina knows this better than all of us combined due to hurricanes and flooding. And some of us have had it too in our different areas of the state, but Eastern North Carolina certainly knows what this is like. The next thing I want to talk about is pests. And I'll just say really quickly, in our asthma and healthy homes trainings, we show people not only the health effects, but also what they can do at no cost or low cost to deal with rodents like mice and rats, to deal with cockroaches. And you see right here just how prevalent rats and cockroaches can be, rodents and cockroaches can be inside US homes. It's even higher for the more urban areas of the country, as high as 75 to 100% in really urban areas like Philadelphia. So, so I just wanted to point out how prevalent it is and the fact that it is an asthma trigger for many kids and adults. So what do we tell people? The low cost, no cost solutions is sometimes take a little bit of diligence on our part, involve integrated pest management, cleaning, excluding, and monitoring the pests that can get in your home and the conditions in your home. And as a very last resort, using safe or as safe as possible pesticides. And so I'll show you what we mean by those 3 steps. Cleaning means just like it sounds, wiping off the countertops, making sure food is not just sitting around, but in the refrigerator or in a closed container. Using covered trash cans in your kitchen, using covered trash bins outside, and keeping the trash bins outside a few feet away from your home. Excluding, so how do you keep these pests out of your home? Certainly you could use baits and traps, and even the baits, even though there's a chemical solution in say, cockroach baits, they're designed so that it's difficult for children and pets to get to the bait solution, like you see in that image in the bottom left. The bottom right, copper mesh and even cheaper steel wool are really good for plugging in holes to keep rodents and mice, to keep rodents out of your home, rats and mice. That's a key issue about the structure of your home, of your property, finding out how they got in. So you want to find the holes and the cracks that rats, mice, and cockroaches might have gotten into. And you want to either use caulk to seal it up, or you want to use the steel wool, which is cheaper than copper mesh, to plug up a hole to keep mice and rats from getting in. Finally, monitoring. So you want to, and remember, all of this stuff overlaps. So when we're talking about fixing a leaky pipe, you might be dealing with mold and moisture, but you also might be keeping the cockroaches out. So you want to fix the leaks that exist in your home, like that image at the very bottom of the man fixing the water heater. You want to, you can purchase sticky monitors at the home improvement stores that you put in different rooms of the house to get an idea of where your infestation is the worst. And then a humidity monitor, like I mentioned earlier. Ideally, you want your humidity between 30 and 50% in your home. Finally, I want to hit at monitoring the different things that exist in your home. So smoking, or smoke rather, not smoking, but smoke, as in burn your house down smoke. Indoor humidity, which overlaps already. Carbon monoxide, it overlaps already. So the HVAC system, your furnace filters, and then finally radon. So I'll talk about those really quickly. I know I'm probably a little bit over, but I'll go quickly. So fire and smoke, fires and burns and scaldings, by the way, that includes people being scalded, are number 5 among home-related fatal injuries for children. In North Carolina, we had 50 fatalities within a 9-month period from home fires in 2017. So what are some key things you do? Every home should have at least one working smoke alarm where you replace the batteries every 6 months, where you replace the entire alarm after about 7 to 10 years. There is a radioactive source inside smoke alarms that's no good after 7 to 10 years. So you need to change out the entire appliance. You want to keep your alarm free from dust. Indoor humidity. I've already talked about it a lot, but just as a reminder, it helps to prevent with rodents and roaches. Humidity builds from everyday life and from things that are broken in the home, like window condensation or a leaky pipe or a leaky roof. I talked about the humidity range, using those ventilation fans in the bathroom and the kitchen. And by the way, I want to say, I don't have windows in my bathrooms. So when my husband and I bathe, we make sure we either open the door immediately or we turn on that ventilation fan. So I wanted to put that into perspective of how and when you might use it. You want to make sure air is moving throughout your home. Get rid of damp cardboard, carpet, particle board, etc., because those things tend to soak up water, and cockroaches love cardboard. So you want to make sure, again, you're killing a few birds with one stone. When you address humidity, you're also addressing mold, and you're addressing pests. Carbon monoxide, I talked about it earlier. I don't think I said this before, but it's known as the silent killer. You can't see it, smell it, or taste it. That is why you put a carbon monoxide alarm on every floor of your home. And if you were putting in one right now and you only had one alarm, you put it by the bedrooms first, because you want to be awakened. You want to be frightened out of your bed and out of your home if the carbon monoxide alarm is ringing and there are high levels of carbon monoxide in your home. So that's why it's called the silent killer. And you need to have carbon monoxide alarms on every floor of your home, and most certainly right outside the bedroom. It can impact your lungs, brain, and heart. It is most dangerous for the elderly, for people who have respiratory problems and heart problems. It's caused by fuel burning appliances. And I talked earlier about those different appliances like kerosene heaters, unvented gas stoves, the wood log, the little gas logs you use. All of those are considered fuel burning. Finally, I want to mention, just like with the smoke alarm, a carbon monoxide alarm, you need to change the batteries every 6 months, but you also need to replace the whole unit after about 5 to 7 years. It also has a radioactive source inside the machine that's no good after 5 to 7 years. Finally, the HVAC system. I won't go into a lot of detail, just please change your furnace filters, because clogged filters prevent you from getting dust mites, dust, pollen, and other things out of the air that happen to be asthma triggers for a lot of kids. So you want to make sure you are adequately changing out the furnace filter and using the correct size furnace filter. Couple of quick tips that I use: put the date on it before you install it. If you still can't remember, do it whenever you pay your bills. So if you pay your bills on the 1st of the month, change your furnace filter on the 1st of the month. Anything to kind of help you remember. Finally, I want to hit on radon, which is a naturally occurring gas. This is a slide that sort of shows how radon can get into the water and into the air of our homes. Right here, just sort of in a nutshell, this naturally occurring gas can exist anywhere in anyone's home in the state. It happens to be more prevalent in the mountainous areas. However, any area of the state can have radon in homes. It seeps through the cracks in the foundation and the walls and the joints of a home. It is number 2 in lung cancer deaths behind cigarette smoke, behind tobacco smoke. And if you wanted a kit like the one you see in the top right corner, It's $10 to $15. You can go to that website, ncradon.org, and it will lead you to sites where you can purchase your own radon test kit. Creating systems to divert the radon from the air in your home to the outside can be expensive, and that is why for a lot of low-income families and homeowners, the North Carolina Housing Finance Agency has arranged to help with low-interest loans and with grants to help families deal with the expensive cost of creating that system. Here are just a couple of resources: the NC Healthy Homes website and the website from our program we work with in the School of Public Health. And here's my contact information. I apologize so much, Ken and Gina and Jamila, if I went over.
Thank you, Nisha. I'm sure everybody really appreciated all the stuff that you covered. And it's all is in some way, form or fashion related to the presence of asthma triggers. So, I mean, if a home has an issue somewhere, it's probably likely it is a location or an opportunity for an asthma trigger to develop or for something to become an asthma trigger. So, I mean,
Exactly.
okay, but well, let's move on and allow the other two speakers to talk. So, Gina, you're next, and you should be now able to share your screen. I hope so.
Okay, are you able to see my screen?
Let me hit the share screen again.
It says host disabled participant screen sharing.
Yeah, but okay.
I just made her co-host again.
Okay.
Okay, can you all see it now?
Yes, we can. Thank you.
Hi, everybody. My name is Gina Uresti. I work at the Greensboro Housing Coalition. I am a Healthy Homes team member. I am the Healthy Homes manager as well, which I just started that position a few months back. So I'm kind of getting used to that position. I've actually worked with Nisha and taken her Healthy Homes trainings. They're amazing. I've actually taken them a couple of times. And so basically what I'm going to do is I'm going to go through what it is that we do when we go out to do a home inspection. The home inspection, we like to call it an inspection, but also an assessment, because we also go out there when a person calls. Sometimes they have an issue with the landlord. Say, for example, they're not fixing a leaky pipe, they're not fixing windows, they're not fixing something in the home, and they want us to try to mediate with the landlord. So we'll go out there and do a basic HQS, which is Housing Quality Standards Inspection. And we'll go out there, check the structure, and then seeing if there are things that we can talk about that maybe could better their living situation. So we first start by, we do a walkthrough. We do an intake also. We sometimes try to do it over the phone. Sometimes when people come in, we go ahead and ask them a few questions. So it's basically like, who lives in the home? How many children or adults are in the home? Where do they work? Any homes with the issue? How long they've been there? And we also usually ask them about their lease. Sometimes people have moved in and their lease expires, but they kind of just continue living there. So we have to make sure that we understand whether it's a month to month or if they just renew their lease every year. So basically when we go in, the places where we go, sorry about that. So what we do is we go into the living room, kitchen, any utility rooms, bedrooms, closets, basement, attic, garage. We do an assessment of the outside of the building, make sure that, we see if, like, for example, I just had a person call and let me know that they had rats in their home. So they live in an apartment complex. What I did is I went out there, I assessed the outside of the apartment complex as well as the inside of the home. And that gives me an idea of these rats, like, are they, what is the main reason that they're there pretty much? Is it like the maintenance? Is there high maintenance, low maintenance, no maintenance at all at these apartment complexes? So the first place where we usually go in is the living room. So in the living room, we make sure that we talk to the client, tell them what we're there for them to discuss and reiterate any issues that they're having. Once we go into the home, we start looking at, for example, do they have carpet, hardwood floors? And also we make mental observations and mental notes of like anything culturally that we need to be culturally sensitive to. Sometimes we don't like to make suggestions right at that time because we have to think through things through of like, how would I say, for example, if a person uses incense for religious purposes, how do I tell them that they may or may not trigger asthma attacks or things like that, or breathing problems, also as well as if they don't have a fan, putting the fan on and things like that. So how am I culturally sensitive to their situation? So we go into the living room, we check for any pets. Do they have pets? Do the pets, are they sitting on the couch? Are they in their kennels? What else do I see? So all of these are basically observations that I write down. Sometimes, like I said, I make mental notes because some people only have maybe like a few minutes, maybe a couple of hours to just for us to go ahead and do the assessment at that time. So we like to make sure that we take some pictures. We first ask if it's okay for us to take the pictures of the home. And this just gives us like an idea of what it is that we need to speak to the client, what it is that we need to really explain to them or educate them on how they can better find their situation. So let me see. Okay. So when we do the walk through the kitchen, the observations are, do we see any signs of pests? Do we see any signs of maybe are they using aerosols like Raid or anything like that? And explaining the importance of not using those things. I know sometimes, like I mentioned before, we ask them if they have children. So if they have children, I like to know what the ages are, and mainly because if they have a 10-month-old who's crawling all over the place, I mean, that would be something that I would definitely say at that time, you know, I would suggest not to use these, and then give them different options. So I do take some of the material, the educational material that I have, because there are some things that I want to point out when I'm there. So we check the refrigerators, we check the cabinets, we look at how they store their food. So if someone calls me, say, for example, if they have a pest issue and they call me in and I see that there is food left over, dishes in the sink, things like that, I have to make note of how I can tell them that maybe if we put them into containers, maybe if we don't leave the dishes out, maybe that could actually help better the situation. And once again, we do an assessment. When we do the intake, we do have a budget form that we talk to them about. So that kind of gives us an idea as to whether or not they have the funds to be able to purchase those things. If not, we sometimes try to provide that for them at a later time and just go ahead and tell them how to use it. So things that we find in the kitchen that can be triggers, once again, it's like chemical cleaners. We take some recipes, we call them our green cleaning kit recipes, and we show them how to use, for example, baking soda and vinegar, a microfiber, and a lot of those things that we actually have for the green cleaning kit recipes, we can actually find at the dollar store. So it's very budget friendly. And then we just give them the kit. If we are able to provide that at a later time, we also do that as well if they run out of the things that we have given them. So when we walk into the bedroom, we'll check the light fixtures, we'll check the paint, we'll check the windows, we'll check for ventilation. I have gone to a few inspections where sometimes the closets are used for storage, and clothing is really placed like all over the place or in drawers, or they'll not turn on the fan just because they have some furniture that is really tall, so it kind of blocks the fan from actually working. So those things I have to talk through. We have to try to see where we can move things or how we can, either clean out. And so all those things that kind of go into the component of just looking in their bedrooms and trying to make as many suggestions as possible without offending them at sometimes, because sometimes a lot of the landlords that we do deal with do tell us that that it is the tenant's fault because of so and so, and we basically, the houses that we've been through to, a lot of the times it's nothing that the tenant is actually doing, and when it is, we kind of try to redirect the education so that they can fix those issues and then really address what's going on. Usually it's like a structure, part of the structure of the home. So triggers in bedrooms, mold and mildew, clutter, as I was mentioning, and then dust mites. We often provide mattress, pillow, and carpet covers. The mattress and the pillow covers are really easy fixes to a lot of the things that that sometimes we have clients complain about. So those are some things that we also provide when available. So when we look into the bathroom, we'll run the hot and cold water, make sure it's working, look around the tub, make sure that there are no leaks. We'll step and walk around the toilet to make sure that there is no soft, that the floor is not soft. We check for the leaky faucets or pipes. We check that when we flush the toilet, there is no water spilling. We check for the exhaust fan. And Nisha also was telling everybody about how the toilet paper, putting that in the fan, and if it sucks it in, it's working. We do that the same in the bathroom. So we take a piece of toilet paper, put it towards the fan, and if it continues to suck it in, then it pretty much works. And if it doesn't, we also write that down in our notes, because that's something that we would talk to the landlord about addressing that issue. So once again, triggers in the bathroom, mold and mildew. We're very careful when we go out to classify anything as mold. At GHC, we only have 2 of us doing inspections, which is my coworker Ken Cook and myself. And the reason that we're careful about telling people or agreeing with people when they call and tell us it's mold is because there are so many different categories of mold that we don't have the capacity yet to tell them what type of mold, and that's really where people want to get at. It's what type of mold is this making me sick? So because we don't have that, we always address it as mildew, and we try to see if if it's a really bad condition, we try to see if we can get them, either if they're in an apartment complex, get the landlord to move them, or just try to move them out of their home and seeing if we can find better housing for them. Personal care products, sometimes people don't realize the chemicals that are in there that they could also be allergic to. We did have a client a few years back who was allergic to a body wash, and the body wash was supposed to be organic, but there was something in the body wash, and until she got an allergy test, she didn't find out that the chemical in the body wash was the one that was actually making her skin fill up with rashes and hives. We also check in garages. Sometimes that's like not, a lot of our clients do not have a garage, but we also check in there because sometimes paint, the strong odors in the vapors, glue, gasoline fumes, any of that can also be a trigger for any breathing problems or asthma, especially for the children. Sometimes children get in there and parents don't even know. And I do want to mention that for the most part, we do mostly home assessments and inspections for renters, but we also go out there and do the home assessments and the inspections also for homeowners. And so once we're actually done with the walkthrough, if the client has time, we sit down and we do what's called a client housing action plan. And we basically identify what we saw, how we could better assist the client and what education we can provide. Sometimes we do, like I mentioned before, we do it at a later time, and we basically just go through each of the rooms and talk about what we can better so that the client is not having any issue. When it's an actual structural issue, that's where we also put in the client housing action plan that we need to talk to the landlord, try to identify any reason as to why the landlord is not making any repairs. So for us, an easy fix would be if a smoke detector is not in a bedroom or in the hallway or anywhere in the house, we ask what the reason for that is, and then we seek out resources to also help the landlord. So we try to mediate, but we also try to help the landlord to see what is going on so that we are also aware of how we can help the landlord and the tenant at the same time. So one of the other things is that when we are unable to mediate the situation, we refer the client to code enforcement so they can start a case. Usually that moves very quickly. We have a really good relationship with code enforcement. They also refer clients to us as well. So we kind of try to work together so that we have the best outcome possible for the tenants. And so this is our contact information. So I'm the Healthy Homes Manager, and then Ken Cook is the Healthy Homes Inspector. Like I said, it's just two of us out there. So sometimes it does take us a while to get back in touch with the clients. We try to do it as quickly as possible, and we try to get the best situation. And I added one more slide because I wanted you all to see, this was actually an inspection that I went to as of last week. No, actually this Monday. And so this actually gives you an idea of the things that I look for when I'm assessing the outside. So for example, this right here, the dumpsters all over this apartment complex, there's trash everywhere. The client has I believe a 10-month-old and also a 7-year-old. So you can see the rats. The rats were actually under the dishwasher. In her utility closet, there are holes that should be fixed, but they have not been fixed as of now. And this is actually the second apartment she's moved to. The first one had issues with sewage coming up. So this is just an illustration of what we find typically when we go out to do the home inspections. And then for her, it'd be trying to move her out once again from her unit or talking to her landlord. In this apartment complex, there's a few abandoned apartments, and those apartments are surrounding her and actually have clutter all the way out to their patios. So we wonder if those issues are actually causing the rat infestation that is going on in that apartment complex.
Thank you, Gina. That was, I think it was very, very informative. Okay, so we can get to our last presenter, Jamila Pender. So Jamila, you should be able to, and you can. That's great.
Good afternoon. Are you able to see the presentation? Okay, good. Good afternoon. My name is Jamila Pender, and I am the Assistant Director for Healthy Communities at Cone Health. And so we have just heard some very good presentations, and so it's kind of hard to follow up with all the good content that they provided. So hopefully what I'll be able to share with you guys will kind of loop it all together. But again, what I'm going to focus on is just the impact of childhood asthma on children. the impact that it has on the health system, and from a patient perspective, who's at most risk in Greensboro, and then talk a little bit about our Build Health project. But I won't, again, I'll go through the slides quickly. And again, like Ken said, he'll be able to pass these out because I do want to make sure that we do have time for discussion.
You're muted.
You have heard a lot about you've heard a lot about what it looks like to go in and do a healthy home inspection, what it looks like, what the impacts of asthma has. And so I just want to talk a little bit about how we at Cone Health are approaching the childhood asthma and housing and what that looks like to us. So in my department, I work in the Healthy Communities Department, and the what we're using as our framework and how we're approaching the social determinants of health is we're using the portfolios of population, the pathways of population health, and using the portfolios of population health as a framework as to guide us on how we are addressing the social determinants from a system standpoint. Majority of the work that I kind of live in is in the third and the fourth quadrant, which is community health and well-being. And community well-being and creation. So you may say, well, what does that really have to do with childhood asthma? Well, one is when we're talking about the community health and well-being component of this, it's looking at what are those specific conditions that we can focus on to be able to bring about health and well-being. And so looking at it from, again, asthma. So as we are treating asthmatic children in our emergency rooms, those that happen to be inpatient, but then also looking at it from an ambulatory setting. So what does it look like for us to address asthma in an ambulatory setting? And then working with our partners as Gina with Greensboro Housing Coalition to be able to address some of those things. And then when you look at it from a community solutions, it's what can we do from a long-term approach to be able to address this? So yes, we know that when you talk about SDOH, it's the upstream and the downstream. How are we addressing this from an upstream approach? And so looking at sustainable interventions and how we can address childhood asthma as it relates to the home environment. So that's a little bit of what I'm going to go through real quickly. Sorry. So how I'll start with that is one of the things that we do is using data. So working with our analytics team to really help us hone in, using the data to help us make the best informed decision as to who we should work with. So as I mentioned before, in that third quadrant of community health and well-being, using the SVI, which is the social vulnerability index, to kind of help guide us as to where we need to go. So looking at it not only from an individual, from a patient or a person's standpoint, from an individual to a family, but also looking at how is our community affected by asthma and childhood asthma and housing. And so using the SVI as a framework to be able to help guide us as to where we should show up, where we have a higher prevalence of children that are experiencing asthma, and seeing if the home environment actually contributes to those factors. So one of the things that we did was we looked at asthma utilization. And so what we did was from 2019 up until present day, what we did was we looked at the number of encounters that we had coming to our emergency rooms, coming to our urgent cares, and those that happen to have inpatient visits as a result of asthma. And so we then took that and then narrowed it down a little bit more, went down, kind of did a deeper dive and said, okay, how many of these individuals that we had that we were trying to look at addressing asthma related problems were actually children. And so what I'll be getting ready to show you with some of the data and some of the maps is, again, focusing on school-age children between the ages of 5 and 18. And these are children that have had visits in our emergency rooms, our urgent cares, and in our inpatient setting. So what you have here is, again, when I talked about the SVI, so we looked at how do we use that social vulnerability index to really pinpoint what areas do we tend to have the highest prevalence of asthma related encounters within our system. And so what you see here is a map of Greensboro. And so based off of the shaded areas, as you can see, you see some of the turquoise, which are lighter areas, and then you see some of the darker areas. It shows us where we have the most vulnerability. And so if you look on our map, and if you're familiar with Greensboro, we have a higher prevalence in our southeast part of our city. And so looking at where you have the highest prevalence of those hospital encounters, you're able to see in the dark gray blue areas, we have a higher concentration, again, like I said, in the southeast part of Greensboro. So then that helps us say, okay, we have a higher prevalence there. Who do we need to work with? How can we kind of solve for this problem? And so how can we collectively work together to be able to address that? And that's what and I'll talk a little bit about our Build Health Challenge project, where we're working together to really look at how can we address these issues from an intermittent point of view, but then also looking at what are those long-term sustainable interventions that we can come in and partner together to be a better, more powerful advocate to be able to address some of these inequities that we're seeing. So what you see here is, like I mentioned, this is from 2019 and it's still present. And so what you see on the left-hand side of the screen are the number of encounters we have. And again, when I talked about using the SBI and looking at the map to determine where we have the higher concentration, we dived down a little bit deeper. And as you can see, out of all the encounters, and that's the maroon, it's the highest concentration. So again, it's in our northeast part of our city and some in our southeast part of the city. We were able to kind of dive in and see we have the highest concentration in this area. So out of these encounters, we had about 1,100 encounters that we had of children between the ages of 5 and 18 that were either, as I said, have gone to the emergency room, urgent care, or have had emergency inpatient admissions as a result of asthma. And so you see where it's heavy up there in the northeast part of our city, and out of that we had 1,100 encounters. Then on the other side shows the visit rate. So when you look at the population, so how many people are in that particular area, we were able to do the percentage. And so this is the concentrated rate of, based off of this area and the number of people that are living in that area, there still is a very high prevalence. So it's a very highly concentrated area. So going back to what Gina had mentioned and Nisha had mentioned, it's like that place matters. So it's looking at, if we continue to have higher concentrations of asthma related illnesses and they're coming from a certain area, what is leading to that? So again, if it's going in and being able to do a home assessment, if it's going in and saying, okay, we can put, back to what Ken was saying in the beginning, there's several different interventions that you can put in place. It's not just a one size fits all situation. So again, is it the mold? And like Gina said, it might not necessarily be mold, but it could be the mold, it can be the dust, it might be other allergens, but is it the actual structure that the individuals are living in that can be contributing to that? And so being able to have this data helps us to make the best informed decision as to what type of programming and intervention that we can put in place to be able to do that. So one of the things that we have done from a system standpoint is we have the SDOH, or the social determinants of health screening wheel. And so when patients are at our primary care setting, one of the things that we set up in our one of our pediatric practices is, if a patient happens to come in and they have a diagnosis of asthma, one of the things that we do is we're able to see how many visits have they had in the past year to the hospital or to the urgent care. And if they've had 2 or more emergency room visits, or if they've had 1 or more inpatient visits, we're able to flag that within our EHR. And then that lets the provider know, hey, we see that this child has a diagnosis of asthma. We see that they've had 1 or 2 emergency room visits or urgent care visits in the past year. Let's see if we can go ahead and put in a referral to have a healthy homes assessment. We'll go in and put a referral in for a healthy homes assessment. And so what that is not only are we saying, okay, we see that we have a patient that's dealing with asthma, we're doing the interventions in regards to providing the asthma training, we're providing the medication to help them manage their condition, but just taking it a step further and really seeing place does matter to see if the home actually is contributing to the asthma outbreaks. And so as a result of that, we're able to go in and under our housing SDOH, we're able to go in and put a referral in to Greensboro Housing Coalition. And at that point, they're able to go in and do a home assessment. And when they're able to do the home assessment, they can determine if the home is actually contributing to asthma exhibition. And so that's one of the things that we're starting to use to be able to identify where there's, if the home is contributing to asthma, and then using some of those interventions that were mentioned in the earlier presentations to see if that is actually contributing. And at that point, then they can then do a referral back to us at the practice setting and say, hey, as a result of this, we put this intervention in place. And as a result of that, there's a decreased utilization in the emergency room as well as inpatient visits. And then now we're looking at how do we take that further and being able to integrate the school component of it. And so that's where I'll talk a little bit about the Build Health Challenge. But before I get to that, just wanted to kind of drill down a little bit deeper with the data that we were able to pull from the emergency rooms and the urgent cares. And we looked at how many unique school-aged children with asthma were coming into the emergency room. So like I said, we started this data we started pulling data from 2019 to present, and we were able to identify out of those visits, out of the 1,100 encounters, 874 were unique visits. So that means some of the children happen to have 3 or 4, again, like I mentioned, ED visits or inpatients. When we pulled that data, we drilled down a little bit deeper and looked at race and ethnicity. And if you see here on the left-hand side, 71% of those out of that 874 unique children were Black African American. And then we had 15% white, and then 8% other, 7% Latino. Then if you pair that with, we said, okay, let's look at the payer source. Let's see what type of insurance they happen to have. 71% happen to be Medicaid patients. And then the next highest was, of course, commercial insurance. So if you pair that with 71% out of the 874 happen to be African American. And then you go in and add that they happen to be recipients of Medicaid. And then you go back on the last map that I was able to show, and you look at the area in which majority of the children that were experiencing asthma were living in. These are areas that are low-income areas that have subpar housing. And so when you put the connection to it where, okay, you have this diagnosis, like Ken said with the data, it's like sometimes we don't know what causes asthma, but if you look at the environmental factors, what part of the environment contributes to the asthma? If it's 71%, from a vulnerability standpoint, 71% African American. And then you look at the payer source, 70% of them are Medicaid. And then you look at the areas and where they live. And if you actually go to those areas, you can see in majority of the places where people are living, they're rental properties. So they're not even homeowners. What are things that we can do to kind of help the patient, from a patient standpoint, help manage their condition, but then also how can we be an advocate? So that's that advocacy arm where we come in, the advocacy and policy arm where we're able to come in and say, hey, we know we can't do it. We hold one piece of the puzzle, but then who else needs to be at the table for us all to be able to collectively work on this issue and to be able to address some of these home environments that are contributing to children with experiencing asthma. Sorry. Sorry, my slide stopped. So one of the things that we And the previous slide I didn't get to show you was looking at the school asthma. And so looking at not only where the children live, but then also going back and looking at where the children actually go to school. And again, when you see the higher concentration of where the children live in Northeast and Southeast Greensboro, and then actually we were able to go and able to map out what schools they happen to go to, leads to the Build Health Challenge that we're all participating in. And so the Build Health Challenge is an initiative where it is a community-based organization. It is working with the local health department. It is working with the health system to look at how can we collectively work together and have a shared responsibility in improving the health of the community. And so one of the things that we're doing with Build Health 3.0 is involving the school system. So using the school nurses to be able to help us with the data we've been able to pull and knowing the locations for the schools as well as where the children are living, how we can all work together to try to solve for this. And so from the health system standpoint, one of the things we're doing is partnering with one of our pediatric practices, but also partnering with within our pediatric emergency room to be able to say, okay, we see that this patient's come in and they've had more than 1 or 2 emergency room visits for asthma related issues, how we can then have that pediatric resident or that pediatric physician to go in and it be flagged in the system and then have a intervention happen, like a follow-up call from the provider to say, okay, so we see that you continue to keep coming into the emergency room for this. Let's go ahead and see if we can do a healthy homes assessment and do a referral. So not only have we moved it from focusing on it from an ambulatory in the provider office standpoint, but also looking at how we can focus on it from the emergency room, because we know they're going to the emergency rooms and they're going to the urgent cares, how we can kind of work together collectively and have one big referral pool that helps us to be able to address it. And then we're able to share data in real time so that we can actually go in and put in some sustainable interventions. Thank you so much. And I will turn it back over to Ken.
Thank you, Jamila. One of the quick things I want to say is that in 2015, the Greensboro Housing Coalition got some funds to do a study to look at asthma and housing, and the article that I pointed out to you that I'm part of, that money, that project kind of started things going, and within the last 6-7 years, it's been just so heartening to see how far we've come in terms of recognizing housing as a health issue and how much progress we are really making in this community. Because a few years ago, Cone wasn't interested, to be quite honest, wasn't interested in focusing on housing. I'm not saying no doctors or no one there, but they have done a 180 on this thing. It has been just so wonderful to see it happen. As Stephen mentioned at the outset, in terms of Invest Health, we've had a number of initiatives where we really are moving the ball forward and really are making some progress. But as we talked about today, there's a lot to be done, and it's a very challenging issue. But I think you can hear from our presentations today, it's also a very potentially rewarding challenge worth taking on, because as Jamila pointed out, just in terms of the number of poor children and poor families, if we can make a dent in that, if we can change some of their housing so some of those kids don't have to deal with asthma on a daily basis, wow, what an outcome that we can achieve. So I know we don't have much time left, but I do want to open it up. But before we move on, I want to thank my co-presenters today. I think you guys did a fantastic job covering things, and also I want to thank everybody who's attended today. And I hope you will carry the banner in terms of addressing asthma as we go forward. But let's go ahead and answer a few questions that you all might have.
Yeah, we just have 2 questions in the chat so far. Robin Lane, did you want to ask your question? Robin may not be available, but her question was, please comment on the multiple reports of dramatic drops in asthma since COVID-19, especially in those who are staying home. Do you agree with some of the observations that better asthma management and stress reduction might play a bigger role than we knew before?
Thank you,
Robin, did
Stephen.
yeah.
I'm here, but I couldn't get my unmute button to work. Thank you.
So Robin, kind of, if you would kind of restate your question. I think I understand it, but could you kind of restate it?
Well, it was brought into common understanding last week with a report on NPR. And since then, I went back and did some online literature searches to see if it was true that there was a dramatic drop. And what was curious to me, there was one study that included 1,000 participants, including groups from Durham as well as Mecklenburg. So it's relevant to North Carolina. It was out of Boston, and I'm not sure whether it was Deaconess or Beth Israel, another hospital. But it's confirmed in other studies that there has been a dramatic drop in the prevalence of asthma during COVID. And what was particularly impressive and perhaps surprising was that this was not amongst people who had to go to work, but people who stayed home. The biggest drops were in those who were working from home. So it was African-American and Latinx populations. So those that are particularly sensitive and at risk, as we've noted today. So I just wondered what your theory was as to how this might be occurring. Apparently the data is real and revealing.
Well, I guess I can start. One thought I have, because actually, I did read an article recently. It was an article that kind of addressed that issue, but it wasn't locally. This was over in Europe. But I guess I wonder. I don't dispute that what's been reported, but I would wonder about the what they're measuring in terms of saying that there's a reduction, because one of the things that's true is that if you're not leaving your home, you also are not going to the doctor. You may be making differences in terms of making your choices about how you are addressing when your child does have symptoms. So if we had a little more understanding about what the family has done differently, that would help. But it is an intriguing observation. Absolutely.
I've heard it anecdotally too, from folk from public health professionals we work with, who work with asthma patients, that they are also surprised to see a reduction in the past year of ER visits among their patients. And so I'm a little bit alarmed. I do wonder a little bit, just knowing the housing makeup that people are living in and exposed to. I'm curious to know more about the self-reporting there. I just want to say, and like Ken, I'm not refuting the data. I'm just saying that what suddenly happened that everybody's house was okay.
Yeah.
You know, and all of a sudden the ER visits stopped. So again, I'm not questioning any data that was collected, but it is, I am surprised. I will say this though, keep in mind that, you have a lot of systems, UNC included, who have made the most out of telehealth and other opportunities to have ongoing communication with families. So in the sense of that data being, I don't want to say it wasn't true. It's certainly true. That data, I'm not refuting the data, but in the sense of the data not being confusing, when you think about other factors like people using telehealth to keep in touch with their patients, that can't be ignored either. The different ways that people have tried to stay engaged with families cannot be ignored.
And I would add to that as well. And again, not refuting the data, but just one or two ways, because I see it differently, because we, and this is just a systems perspective, because during COVID, one of the things that people did was stay away from your emergency rooms and your urgent cares. And so like Nisha said, it's that self-reporting component of it. So there was a decrease in going out into these services, seeking these services at these facilities, number one. And number two with that, and when you look at it from an overall perspective, especially from a pediatric standpoint, there has been a decrease in the number of wellness visits as a result of COVID. So with wellness visits, with immunizations amongst our pediatric amongst the pediatric population. So when I hear stuff like that and I see what's really happening and I see the numbers where the kids aren't getting the visits and they're not coming in, and we've put out for the past 8 months, don't go to the emergency, people were afraid to go to the emergency rooms and delay treatment for fear of getting COVID. A lot of people were in the home. And so as people being in the home too, one, like you said, is everybody's home healthy? One, that kind of makes me think. And then two, also place matters, because again, when you look at from an adult standpoint, if you're going to work, there's many environmental factors at work. And if you spend probably 2/3 of your life at work and you're now longer not in those facilities that can be contributing to your health and well-being, and then you're going home where it's a much more controlled environment where you can control some of those factors, you have to look at that. And then especially from a child, and I don't want to go into this because I don't want anyone to be like, oh, Jamila said this, but then again, based off of the data, when I showed my map around schools, if you look at the schools that are in certain neighborhoods where people are living, are the schools contributing to the children and their asthma? And I don't want anyone to say, Jamila said that, because I didn't, but if you just really look at it, because again, when you looked at schools getting ready to open and they were looking at, how do you get your businesses ready? How do you get your offices ready? How do you get the places that people are frequently ready to be able with COVID and making sure the air is right? A lot of the schools had to do a lot of things to get the schools up to where they need to be. So again, if you took kids and adults that were in one environment and then you're transitioning to another environment, there's so many different contributors as to why you have asthma and asthma related illnesses, and place matters a lot. So to me, when I hear data like that, yes, I can believe that, but then also the other side of it, I'm like, okay, but there's more to it. And like data can tell so many different stories, but just being mindful of, what is the problem? What are we trying to solve for? And what's getting in the way? And what are some of those obstacles? So being mindful that the home contributes just as well as the outside environment, and how this works, it's a shared responsibility. We're all responsible to help improve our community, to improve the health of our community. And that's why these conversations and these hangouts are a way for us to really start thinking differently and saying, okay, I didn't think about that. Because again, just from a health system perspective, and me personally just being like in the field during COVID, I'm telling you, a lot of people are still not accessing service. And so it'd be interesting to see what that data looks like.
And I wanted to point out another thing, once again, like all my colleagues, not refuting any of the data, but a lot of people were just scared to actually report anything because of the whole CDC moratorium, and afraid that they were going to get kicked out, not being able to pay the rent and things like that. So that's another factor to take into consideration. I know people we were talking to and clients we were previously seeing, like before and during the pandemic, a lot of them did not want anything to do. Like we would say, send us videos of the home, send us videos of the issues. And they were like, no, we just want to kind of keep it quiet. We don't want to start something, where were we going to move? We can't stay in hotels. We can't find a place. They're not leasing. We don't have the funding to do it. So I think that's another point to take into consideration.
I agree. We had to do some tweaking with our trainings, as some of you know, during COVID, our virtual training, well, we didn't have virtual trainings before COVID. So the virtual trainings, but if you go to the the Legal Aid and North Carolina Justice Center websites and look at their frequently asked questions site, there were clearly other issues that families were paying attention to besides asthma and lead. You know, they were focused on eviction and other issues. And we had to even recognize that in our training so that people knew where to go to share resources with families. So yeah, I mean, I think we all agree, we don't refute the data, but something about self-reporting, just not that clean, you know.
There's another small possibility for some of that improvement, and I'm going to say a small possibility. You remember when folks were locked down or essentially in their homes, they had an opportunity to fix their homes, they had an opportunity to clean their homes. And you know, if I was looking at those families, I'd want to know, what did they change? What behaviors did they change during that period of time? Because maybe they were removing or at least reducing some of the asthma triggers. Maybe not necessarily intentionally, but maybe that's what they ended up doing. So again, yeah, like everyone else has said, the self-report data is useful to some extent, but we've got to be cautious about just concluding that, gosh, COVID caused a reduction in asthma. I don't think anybody's saying that, but somebody hearing that who's not well informed might draw that conclusion.
Sure. Another question that came up, I don't know if we're referring to the chat box, but someone asked about, is it possible to outgrow asthma? And, you know, we've heard that question a few times in my time at UNC. And our researchers, and if you look at the research in Southern California and other parts of the country, but research of children between the ages of 10 and 18 and even younger in Southern California are clear that kids are not outgrowing asthma, but their asthma drastically improves because they have been moved to a better environment. And so when people say, and you know, I'm careful when I cringe a little bit, I'm careful with who I correct sometimes, but you know, people don't just outgrow their asthma. There are two things that our researchers have said that you have to pay attention to. Number one, they move to a different environment that, or they have done something in their behavior that made their asthma better, their asthma outcomes better. And number two, you really have to think about what happened at the time that a person was diagnosed with asthma. There are other conditions, especially among really young kids, 5, 6 years old. Reactive airway disease is one term that's used, but it's not exactly asthma. And so, you know, researchers point out that sometimes it goes back to how the kid might have been diagnosed early in life and whether they really did have asthma. So I hope that answers your question, but that's what I've experienced in my work, working with pediatric pulmonologists at Carolina.
And I want to quickly share something. I know we're running out of time. Piggybacking off what Nisha was saying, I had a client who we moved at the same time that she was getting medication from her home country. So she attributed the reduction in asthma attacks of her child with the medication that she was getting from her home country, as opposed to when we helped her move into safer housing. So, I mean, it's hard to argue with, you know, with a person and say, I don't think so, but I feel like the education, and that's one of the reasons that we're mainly here and that we mainly try to do the home assessments and provide as much education as possible, is because the more education a person has, the better the life quality that they'll end up having. So I think that is a big piece that really helps people as they start growing older. They tend to steer away from things that maybe when they were younger they couldn't help, but now that they're older they don't do that, and then they're children, so it kind of has a better continuance, a better life.
So we'll be wrapping up here. On our website, chcs.uncg.edu, we will have a posting of the recording and all of the materials that were shared during this housing hangout. Remember to join us again next month, first Friday, for Housing and Education. I want to thank all of the panelists and Dr. Ken Gruber for having hosted this session. Lots of information, very useful for those who are working directly with community members around health and social determinants. Thank you, everybody, for coming, and we hope to see you again next month.
Have a good one, everybody.
Thanks.
Bye.
Bye.
Bye-bye.